So guys, welcome back to part 2. So we have already finished our part 1. So who have not watched part 1, watch that part 1, okay? Then come to part 2, and majority of the things which are in part 1 are repeated in our part 2. And try to discuss these things like cultural media and all the parasites with your friends, okay? So that you can remember for larger period of time. And if you live in home, I am there to discuss with you. All the best. Let's start. Okay. And the first media, cultural media which you are seeing is a Mekong agar. Mekong agar is a differential media differentiated between the lactose fermenters and non-lactose fermenters. Lactose fermenters will be pink color colonies, non-lactose fermenters will be pale color colonies. And lactose fermenters are E. coli and Klebsiella. E. coli will be thin pink color, and Klebsiella will be thick pink color colonies. Okay, this is Mekong agar. Next, the one which you are seeing is a blood agar. On blood agar, three types of hemolysis will be seen: alpha hemolysis, beta hemolysis, and gamma hemolysis. Okay, alpha hemolysis is a partial hemolysis of the blood. Beta hemolysis is a complete hemolysis of the blood, and gamma hemolysis means no hemolysis. And they will ask one example is enough for each. For alpha hemolysis, you can take Staphylococcus Streptococcus pneumoniae. Streptococcus pneumoniae is example for alpha hemolysis. Streptococcus pyogenes is for beta hemolysis, and Enterococcus faecalis is for gamma hemolysis. Alpha hemolysis, Streptococcus pneumoniae, Streptococcus pyogenes, Enterococcus faecalis. Okay, remember all three: alpha, beta, and gamma hemolysis. This is blood agar. And next is the chocolate agar. When nutrient media we will add some sheep blood to it, that will become blood agar. When we heat at 75 degrees Celsius, it will become chocolate agar. Okay, and now it is chocolate agar. And chocolate agar is for Haemophilus influenzae, because Haemophilus influenzae need both factor 5 and factor 10. Okay, and these are present inside the RBC. When we heat the RBC, the factor 10 and factor 5 comes out, and Haemophilus influenzae can utilize it. Okay. Next, the red color culture media with black color colony, it will be Corynebacterium diphtheria. Okay, that is potassium tellurate agar. Corynebacterium diphtheria. Red color culture media with black color colonies. Next, something which is green in color will be TCBS, thiosulfate citrate bile salt agar. And on TCBS, which type of colony will be seen? Colony of cholera will be seen, which is yellow in color. Okay, and another one greenish type of some kind of green color culture media is there, that is Wilson Blair media. Okay, Wilson Blair media, which is grown for salmonella. Okay, the most common will be TCBS. Next, you can see this is a nutrient agar. Nutrient agar means it is the first basal media to which like blood is added, it will become blood agar, and that we heat, it will convert into chocolate agar. This is the most basic, like basal. Next, LJ, Lewisham Johnson media. Lewisham Johnson media is for tuberculosis. The one you are seeing, this is a brain heart infusion, which is for both aerobic and anaerobic. And how to remember like it is a brain heart infusion? In exam, the label will be closed. Okay, something which look like alcohol will be brain heart infusion. This is also Lewisham Johnson media. This is low efflux serum slope. Okay, low efflux serum slope is used for Corynebacterium diphtheria, LSS. And this is another brain heart infusion. You can see it is written there, brain heart infusion. According to new update of YouTube, you can zoom also, you can zoom and see it. You are seeing here, you are having both solid media and liquid media also in the same bottle. Then it is biphasic. Bi means two are there, no, solid and liquid, biphasic medium. The why both solid and liquid are there? Because we are added agar. Okay, agar is something which given say state. If more agar is added, it will become solid. If less, it will become semi-solid. If it is very much less, it will become liquid. Okay, this is the Castaneda's biphasic medium. You can see both liquid and solid are there. Castaneda's biphasic medium. Something which is as white as milk, it will be milk agar. Okay, milk agar. Milk agar gives pigmentation. Okay, pigmentation. As I already said, something which is green in color and yellow color colony, it is TCBS. Okay, which is for cholera. Another one which is something like yellowish in color and we have orange color colony, it is for Staphylococcus aureus. And this is a nutrient agar with orange color colony, that is for Staphylococcus aureus. Okay, nutrient agar with orange color colony, Staphylococcus aureus. And so we got our pink in color. So what will be pink? Okay, pink is seen in lactose fermenters. Okay, lactose fermenters will be pink in color. And what cultural media will be there? McConkey agar. McConkey agar is a differential media which helps in differentiation between lactose fermenters and non-lactose fermenters. And pink color colony is in. And how pink color colony is very much thick, then it will be Klebsiella. And if it was thin, it will be E. coli. And you are seeing some 3 types of colonies in the same one culture media. 3 types of colonies in one culture media. That will be milk agar. Okay, milk agar, 3 types of colonies in one culture media. And what are the 3 types of colonies? Staphylococcus aureus, Staphylococcus citrus, Staphylococcus albus. Staphylococcus aureus will be orange in color. Staphylococcus citrus means lemon, it will be yellow in color. Staphylococcus albus will be white in color. Okay, see the previous part 1. Okay, see the previous part 1, first watch it. Next, McConkey agar, pale pinkish color colony, E. coli. McConkey agar, pink color colony, E. coli. It is very much thin. If it was thick, it will be Klebsiella. Next, most famous and almost it will be kept only. It will be like Muller-Hinton agar, which is for antimicrobial susceptibility testing, and it is done by disc diffusion method. And we will take vernier caliper and we will measure the diameter of that, and we will come to know how much sensitive or resistant a bacteria is for a antibiotic. Okay, Muller-Hinton agar, antimicrobial susceptibility testing, disc diffusion method. Okay. Next, this is also Muller-Hinton agar. Something like this, three things you already know. It is for Aspergillus niger. We can see black color colonies, and the cultural media is SDA, that is Seborrhous dextrose agar. Okay, Aspergillosis, which is SDA with green color colonies. It is Aspergillus fumigatus. What are the other one species of Aspergillus? Aspergillus niger, Aspergillus flavus, Aspergillus fumigatus. This is roundworm. Okay, roundworm means Ascarias, causes Ascariasis. And this is liver fluke. You can see it is a liver fluke, small, it's called liver abscess. So something which looks like a tape type, we already saw in previous video also. Tape like, it is tapeworm. Okay, Tinea tapeworm. If they want, they can keep some other things also, like some like surprise. They can keep these things. Okay, and this is a Lifebuoy hand sanitizer which contains some amount of alcohol in it. And the one which you are seeing a container here with red color cap, it is a universal container which is used for collecting the specimens. Universal container. This is a betadine solution, which is most commonly used in your hospitals also for before doing any surgical procedure or inserting a needle. They will use this. Okay, antiseptic. This is a surgical spirit. My storage is going out, I know. This is a surgical spirit. Okay, this is a Listerine. Listerine is used as a mouthwash. Besides is a Savlon. The one which you are seeing, it is a filter. Okay, candle filter. Swab, sterile swab. Wait, let me show. The one which you are seeing upside. Okay, this is a tuberculin syringe. Okay, tuberculin syringe which is used for Mountex test. I already explained previous video. And this is a sterile swab. Sterile swab, which is sterile. Which sterile is used? It is written on upside also. It ethylene oxide. Okay, ETO. It is written like ETO is used for sterilization of this. This is VDRL, Venereal Disease Research Laboratory, which is used for syphilis. They will take a VDRL reagent and they will add patient's serum to it, and patient serum has antibodies. Okay, and it will form a coagulation. So you can see clumps, type it in clumps. You can see it's for VDRL. Next, microtitral plate, ELISA. Okay, 12 into 8. 12 is a 96 wells are there. Microtitral plate, ELISA. You can see here, these are 2 types of wires. One is bacteriological loop or inoculation loop. Another one is inoculation wire. Okay, they will take bacteria like this, and they will use for heat fixation, like smear preparation. It will helpful. Okay, and it helps in picking up of the colonies. It is a most important, and it took me very much time to know what it is. This is a candle jar. Okay, they will apply. They will put one candle and burn it and keep the cultural media, and they will close the lid. As oxygen is taken up for burning of the fire, anaerobic environment is created. Okay, it helps in growth of anaerobic organisms. This is a candle jar. Next, this is also another one anaerobic instrument. Okay, and helps in growing anaerobic organisms. This is Macintosh field X jar. Okay, it is written on upside also. Next, there are some vials. Okay, we will just go through what kind of vials are there. Okay, This is a CRP, C-reactive protein. C is means carbohydrate. Okay, C-reactive protein. This is also sterile swab. They are sterile from in laboratories. Okay. Okay, the one which you are seeing here, it is a Robertson cooked media. Robertson cooked media is an anaerobic media which helps in growing of anaerobic organism. Example, Clostridium. Okay, Clostridium perfringens. When initially it will be like this pale in color. Then when after some time, as the anaerobic organism growth, it will convert into black in color. Okay. This is you can see this what it is. You almost like vials will be there. The name will be given on upside only. This is a pneumococcal hepatitis B conjugate vaccine. This is pentavalent vaccine. Okay, it is written like a diphtheria, tetanus, DPT, hepatitis B, and influenza. DPT, diphtheria, pertussis, tetanus, uh, another two, hepatitis B and influenza. Okay, what it is? It is poliomyelitis, polio vaccine. Okay. The one she is holding finger, no, it will be like some two drops. It will be already inside it. There, just we have to press it, and two drops will come out. Okay. This is a pentavalent. You can see like diphtheria, pertussis, tetanus, hemophilus, influenza, and type B conjugate hepatitis B. This is a hepatitis B vaccine. Okay, separate. DPT vaccine. I will make another one video of vaccine itself. Like I will explain national immunization schedule, and I will tell you the tricks like how to remember in very much easiest way, because it was one of my seminar topic, like national immunization schedule in community medicine. And you can see this is a OPV, oral polio vaccine. Like vials, it will be like easy only. They will give name. It's upside. You can see it is like measles vaccine. You have to just see and write, and they will ask like at which months it will given, and at what is its immunization schedule. You can write like 6, 10, 14. Pentavac OPV rota 6, 10, and 14. And PCV1 and PCV2 and fractional IPV will be given. Like I will make another one video. Just see this vials. Okay. Bacillus calmette-guerin BCG vaccine, which is given intradermal on the left upper arm. I think you can see you will also be having BCG. This is a dengue day 1 test. Okay. And upside you just read like what it is written. Rapid visual test for detection of dengue NS1 antigen and differential detection of IgM and IgG antibodies in a human serum. Okay. And you can see the one more picture is there. See, this is a test kit. Okay, you can see like NS1 antigen. NS1 antigen is a characteristics of detection of dengue virus, and you can see IgM and IgG. And here there is a you should put that serum into it, and they will use two principles. Okay, lateral flow assay and flow through assay. With this principle, there will be formation of a band there. Okay, helps in detection of dengue. What it is? What is you can see? This is a tri-dot test. Actually, there will be three dots for HIV1 and HIV2. Another one will be control. Okay, tri-dot test for rapid diagnostic test for HIV. This is for dengue also. One more thing, IgM for acute, and after chronicity it will become IgG. This is a HEPA card. HEPA card is for hepatitis B. Okay, if you see like it is HEPA card, it will be for hepatitis B. You can see it is written like HCV. It is for hepatitis C virus. Okay, we have come to an end. It was a very lengthy video. I think I will make one more video if possible. If I get the content, I will make another one video of this practicals only. Until then, see you in the next video. Jai Hind, Jai Bharat.